This is an example of a bisected kidney with an infarct. The kidney has an end organ arterial circulation. Causes of infarction include emboli from the heart, often due to atrial fibrillation, or atheroemboli from the aorta. Vasculitis, such as polyarteritis nodosa and hypercoagulable states, can also contribute. Grossly, these infarcts are white, sharply demarcated, and may contain small hemorrhagic foci. The cut surface reveals a wedge-shaped infarct with the apex at the medulla and the base at the cortical surface. There may be some sparing of the subcortical tissue due to capsular circulation. Over time, the infarct will progress to firm fibrotic scar tissue with areas of depression along the capsular surface. This is what we see in this case here, as this is a remote infarct. So a wedge-shaped fibrotic scar with an associated capsular depression.